It is truism today that economic success the world over is based on good health and education. And food and nutrition are the basic building blocks of health. It is not just an end in itself. Nutrition leads to many social benefits, including reduction in infant and maternal mortality rates, sound health for lactating mothers, increase in labor productivity, rise in civic consciousness, and greater economic empowerment. Food security is a basic component of good health. The foundation for a healthy life is laid in a mother's womb. As such, food is a source of life and is vital to healthy living. Indira Kranti Patham is the single largest grassroots empowerment project in South Asia, which in fact is community demand-driven rural poverty reduction program. Andhra Pradesh has over 630,000 self-help groups with a mammoth membership of 80 lakh women, and it is still growing. As a result, today the program is present in every village of Andhra Pradesh, including the remotest areas in the region. Every single woman is striving hard to maintain food security, which in turn leads to good health. As you drive the 80-odd kilometers from Visakhapatnam, the port city, to Golugonda Mandal, the green landscape is relieved by clusters of huts, home to the people of the region. People here live in little hamlets that are far apart from each other and engage in dairy farming or trading. The population here is 1,150. The low access to healthcare meant that women often could not even resolve simple health-related problems. There was little or no access to antenatal healthcare and safe deliveries or the overall health of women. It was in this remote place that a village organization, the Federation of Self-Help Group, chose to start a nutrition-cum daycare center. The idea to have a community-run center was an innovative approach to deal with the lack of primary healthcare facilities in the region. Since women could handle the basic requirements such as balanced diet for pregnant women, routine checkups and daycare facilities for little children, and imparting knowledge on childcare practices, this new model was a sustainable way out. The center started in a small way with the women being trained at SERP as health community resource persons on a range of health-related problems, from proper diet for pregnant women to antenatal care and also primary diagnosis. In addition, they were trained mainly on various techniques to counsel the mothers, in-laws and husbands, and also helping the village organizations to prepare microcredit plans and procurement plans. Parla Gangaratnam is a 25-year-old disabled woman. She belongs to a very poor family and hails from a remote village, Puttadigayrampeta of Golugonda Mandal. Within 6 years of marriage, she had 2 abortions and gave birth to a stillborn baby. Disheartened over her poor health and dwindling economic resources, Ganga was left with little choice. Then one day, she heard of Lakshmi Parvati Group. She felt motivated to join the self-help group as a member. During her 4th pregnancy in 2006, she was enrolled in the nutrition center of the village organization. Here, she was provided nutritious diet for 6 months, from the 4th month to the 9th month of her pregnancy. Then followed complete antenatal care at fixed nutrition and health day organized in the village. Ganga gained 12 kgs in weight. She delivered a healthy baby weighing 3.25 kilos at the government hospital, Narsipatnam. As a result, Ganga and her family members have become change agents in the village to motivate women and children to get enrolled in the nutrition center. Nutrition cum daycare centers across the state have come as a boon to scores of poor women and their little children. Since its inception, there is no case of low birth weight babies. The success of the program is based on the strong institutional structure of self-managed institutions of the poor. This begins with the building of social and human capital, the first step towards organized social change activity. Periodic surveys are conducted by the members themselves to identify people who have crossed the line of poverty. Once this is done, the self-help group members who have not only come out of the poverty with financial assistance, but who have also honed up their skills in specific areas like social mobilization, gender, marketing, procurement, and health are identified as community resource persons. They act as guides, role models, and functional specialists to help the members. Today, the community resource persons are doing human service in sensitizing women on various aspects of health and nutrition. The center of focus being lactating mothers and the newborn child. Microcredit plans are prepared to provide a balanced diet for pregnant and lactating mothers for a period of 18 months. That is, 4 to 6 months during pregnancy and 12 months during lactation period, and also for children below 5 years. Meals provided twice a day per woman works out to 25 rupees. For a child, it is 10 rupees. The women's contribution towards this is 18 rupees, while the village organization extends 7 rupees a day. In order to facilitate the nutrition center's activities, the project extends financial grant to the village organization, which in turn extends loans to women to meet the cost of the meals. The loans are repayable in easy installments. To enable the poor get enrolled in the nutrition center, the project provides financial support to the members' families to take up income-generating activities. Armed with the plan, the women members procure groceries earmarked for balanced diet. The daily ration plan is drawn out as per the number of pregnant and lactating mothers listed at the nutrition center. As an offshoot, kitchen gardens have sprung up in and around the nutrition centers managed by the members themselves that directly provide greens to the center's kitchens. The cook, who is also a self-help group member, prepares food with focus on balanced diet. She plays a hard and soft role, motivating the pregnant women to have a wholesome diet. Proper diet provided at the centers for infants and up to 2 years ensures proper brain development of the tiny tots. The fixed nutrition and health day at the center takes care of the periodic health checkup, immunization, and awareness among the pregnant women. The quality and quantity of diet is as per the Indian Council of Medical Research. The self-help group members themselves maintain the accounts and registers at the nutrition center. It is the traditional wisdom and training of these women as health community resource persons that form the backbone of the nutrition cum daycare centers. The entire effort has led to the health subcommittees, the health activists, primary healthcare staff in the field, and the state working as a team to make healthcare system more accountable. The centers have developed into a health initiative with focus on balanced diet interventions for pregnant women and malnourished children. The issues too have extended to a wider range covering education, health risk fund, health insurance, and management of childhood illnesses such as diarrhea and pneumonia. The self-help groups take care of the resources, support and administration, while the state looks after the logistics support. The impact of nutrition centers statewide has been tremendous. A number of families in over 1,500 villages have had a noticeable change in the food consumption patterns This can be further observed comparing the project indicators with the national figures. Andhra Pradesh has well laid out plans to achieve the Millennium Development Goals pertaining to nutrition-cum daycare centers. The self-help group movement is the everyday guide to women's empowerment, from microfinance management to income-generating activities, livelihoods to youth employment, community kitchen gardens to health risk fund and community-managed health insurance, food security measures, running dairy farms, marketing, social development activities. The list is endless. Many see it as a success story. For the self-help group members, it's a great idea honed over time. Bringing health to the community.